The topics which will be covered are necrosis, apoptosis, acute inflammation, and thrombosis. First topic, necrosis. This topic will proceed in the following manner: definition, morphological changes common to all types of necrosis, different types of necrosis, cause, mechanism, morphology of individual types of necrosis. Now, what is death? This is not a philosophical question. A person dies. You can take kidney from him. You can take heart from him and donate it to a living person. That means kidney is alive. The heart is alive. Then what dies? It is a brain death. It is a headquarters which controls all the coordination of different systems. That is the one which is dead. Exactly opposite, exactly reverse is the true for necrosis. The person is alive. The tissues are alive, but a number of cells in the tissue are dead. So basically, necrosis is spectrum of morphological changes that follow cell death in a living tissue. The tissue is living, but the cells have died. Irreversible change. It cannot be brought back in spite of the fact that any of the insults which is causing it is withdrawal. Okay. So morphology common to all types of necrosis. First principle is the morphology that we see under the microscope or with naked eye takes time to develop. What I mean to say, we will take the example of myocardial infarction. That is the heart attack where the coronary arteries are suddenly blocked and the blood supply to the heart muscles has failed. Okay, this event has occurred at 8 o'clock in the morning. The patient dies of a complication, let's say at 8:30. Sudden death, no change will be detected. We cut open the person, perform autopsy, see the heart macroscopically, gross and microscopically, no change whatsoever is seen. Let's say the person survives for 4.5 hours. 8 o'clock he has sustained. About 12:30. Let us say this person dies. Okay, there are some chances that we may say some gross changes. But let us say the person survives till 12:30 in the evening. Okay, then 12 hours have passed. Okay, 8 o'clock in the morning he has sustained. 8 o'clock night or after that, 12 night, anytime he dies, then definitely we are going to see both the gross and the morphological changes. That's what I mean by saying that it takes time for the morphological changes to develop. Meantime, intracellular contents leak out like troponin T or creatinine kinase enzymes, which can be used for diagnosis of myocardial infarction. Now, necrotic cell, how does it look like? These changes are common to all types of necrosis. First is the cytoplasmic changes, increased eosinophilia, more pink color to the cytoplasm. Why does this happen? The rough endoplasmic reticulum, it swells because sodium has entered inside, along with it water has entered inside, and the organelles are swelling. The lining ribosomes, the granulations, they are pinched off. They degranulate, and these ribosomes, they carry basophilic color. So basophilic color is gone, it becomes diluted, so the cytoplasm becomes more eosinophilic. The next one is increased binding with the denatured protein. The eosin binds with the denatured protein, more eosinophilia, glossy appearance, shiny appearance. That is because of loss of glycogen, which is used in the metabolism. Vacuoles and moth-eaten appearance in the cytoplasm, basically enzymatic digestion of the organelles. The lysosomes have burst open, their contained enzymes have digested the organelles. Calcification, we know all the dead tissue attracts calcium, dystrophic calcification, Then myelin figures are there. What are myelin figures? They are the whole phospholipid masses. Where does the phospholipid come from? From the plasma membrane, the organelle membrane, which have ruptured open. We know that the plasma membrane is a bilayered phospholipid membrane. Okay, what are the nuclear changes? Nuclear changes are pycnosis, karyorrhexis, and karyolysis. Pycnosis, the nucleus becomes smaller and smaller, condenses become more dark, and ultimately vanishes. Karyorrhexis, where the nucleus is cut into many small fragments, and then that also vanishes. Karyolysis is what? Slowly fading off of the nuclear chromatin. So these three changes are seen in the necrosis. What are the different types of necrosis? We have got coagulative necrosis, liquefaction or the liquefactive necrosis, caseous necrosis. These three are the main ones covering 90% of the lesions. Then we've got fat necrosis, fibrinoid necrosis, gangrenous necrosis, which is basically combination of coagulative necrosis with super added infection, putrefaction. Some people include it in the necrosis, but we will deal with it separately. Basically, these different types are caused because of the balance between the proteolytic, that is the liquefactive enzymes, and the coagulative enzymes which are present in the cell, that particular cell of that particular tissue. Okay, this different type also gives us the idea what was the cause, etiology. Is it ischemia? Is it inflammation? Is it tuberculosis? Okay, so we will see what these three types of necrosis actually are and what is their morphology. We can have a simile of egg. I think everybody must have eaten an egg, at least seen an egg, a boiled egg and things like that. What happens is once we boil the egg, the white of the egg, because of the heat, it coagulates. And the shape of the cell is, the shape of the egg is preserved. It's like egg, isn't it? In coagulative necrosis, the coagulative enzymes predominate. The proteins are denatured and they precipitate. That is why the shape of the cell is preserved. However, the nucleus is lost. What is the cause? Cause is sudden severe ischemia. Ischemia is loss of blood supply. And which are the organs which are normally affected? Heart, kidney, and the adrenals are the organs which are commonly affected. Second type of necrosis, important one, is liquefactive necrosis, in which the liquefactive enzymes are more predominant. Here, the entire cell is liquefied. Okay, we can have a simile of an egg, which we beat before putting it for the omelette. The whole thing is a yellow liquid, isn't it? What is the example? Pyogenic infection, an abscess. What is an abscess? Collection of pus in a closed cavity. So pus, yellowish liquid. That is a classical example that you can remember for liquefactive necrosis. One thing very important to remember is this, that brain, any type of necrosis in brain is always liquefactive. Why? Because brain does not have the coagulative enzymes. So any type of necrosis, including that because of the ischemia, that because of the infection, that because of any other cause, is always liquefactive necrosis in the brain. The third type of necrosis is is a combination of coagulative and the liquefactive necrosis, which is caseous necrosis. Here, this is a simile which is to a kacha bhurjia, scrambled egg. What happens is the proteins, they coagulate in small granules. Okay, and they can be seen as granular form of necrosis, which looks like cheesy necrosis. Please remember that cheesy necrosis, which is seen in tuberculosis, when you say it is a caseous necrosis, once you say that it's a caseous necrosis, we are giving the diagnosis of TB. Cheesy necrosis, the cheesy appearance is seen only in the gross examination, not in the microscopic examination. How does cheese look under the microscope? Have you seen it? At least I have not seen it. Okay, so cheesy appearance of the caseous necrosis is on gross examination. Yellowish granular appearance. Any organ can be affected, which is the TB, which is affected by the TB. And any type of TB, primary TB, secondary TB, miliary TB, everywhere the necrosis will be the caseous necrosis. Now we will see certain pictures. This is an oral cardiac muscle. Branching is there. The nucleus is in the center. So definitely it is the cardiac muscle and not the skeletal muscle. Here is the coagulative necrosis in the cardiac muscles. We see that the shape of the muscle fibers is preserved. They are swollen. They are more pink in nature. And inside the muscle fiber, there is no nucleus. All these dots that you see are all nuclei of the WBCs, neutrophils. You can see few of these lobes also. So they are polymorphonuclear leukocytes which are located outside. Shape of the cell is preserved. The cell is swollen. It is more pink and the nucleus is lost. Here is an example of liquefactive necrosis. There was an abscess on the tip of the finger. I think this is the thumb, which was incised, and this pus is coming out. That is what is the liquefactive necrosis. How does pus look under the microscope? Pus is what? Basically, the dirty background given by the liquefactive necrosis of the tissue, the dead and living soldiers of the body, the WBCs, the leukocytes that we see. Under higher magnification, we may be able to see the bacteria also. That is what is the liquefactive necrosis pus under the microscope. There's a liquefactive necrosis in the brain. This is the preserved brain. We can see the cells, the pyramidal cells here, all amorphous, liquefactive appearance, which is present in the brain because of any sort of injury. Caseous necrosis seen in the lung. These are the yellowish white cheesy deposits which are there in the lung. Gross examination. The word caseous is derived from casein. Casein is a milk protein. It's derived from the word casein. Casein is the milk protein, and cheese is derived from milk. That is why we say caseous necrosis. Then we have got the microscopic appearance, granular in the center, but sometimes it becomes difficult to differentiate it from the liquefactive necrosis. So we look for the Langerhans giant cells. They are very big, like giant Ravan. Ravan had 10 heads, isn't it? These have multiple nuclei, and in Langerhans giant cells, the multiple nuclei are arranged towards the periphery in a horseshoe-shaped fashion or a U-shaped fashion. Horseshoe is what? Nal. Ghodyacha nal. Okay. So next one is the fat necrosis. Fat necrosis is basically death of the adipose tissue, which is present because of the enzymatic digestion that occurs in the fat. Free fatty acids are formed which combine with calcium to give rise to calcium soaps. Causes acute pancreatitis. Whenever there is inflammation of the pancreas, the contained enzymes, especially the lipases, the enzymes which digest the fats, they leak out into the abdomen, and what we see is they digest the fat which is present, especially in the greater omentum. Greater omentum arises from the greater curvature of the stomach, covers the entire viscera, and here the fat is there. Behind this loop of duodenum is the pancreas. Enzymes will leak out and will digest the fat which is there. Another example is a traumatic fat necrosis in the breast, especially in the females, where the breast is injured, there will be fat necrosis. Since the free fatty acids combine with calcium to form calcium salts, what we see is chalky white deposits, gross chalky white deposits which are there. Chalk is what? Calcium carbonate. So here we see the chalky deposits which are there. Microscopically, we see the ghost cells of the fat cells, gross fat cells. Along with that, we see this basophilic deposition, which are the calcium salts which are deposited. Next one is the fibrinoid necrosis. Fibrinoid necrosis is basically an immune complex vasculitis, the inflammation of the blood vessels, where antigen has already entered into that particular person. So antibodies are already formed, circulating in that person. When antigen is reintroduced at the second time, it reacts with the excess antibody. Antibody travels from inside the blood vessel to outside. Antigen travels from outside the blood vessel to inside. Both meet in the center, that is in the media, and they form antigen-antibody complexes. These complexes then attract the complement, which causes inflammation out there, and as a result, ultimately, there is necrosis, which looks like smudgy deposit. Smudgy means what? Whenever ink falls down accidentally and we rub it, it becomes smudgy. Fiskat lela. So basically, fiskat lela means what? Smudgy deposits which are present in the blood vessel wall, and these are because of the immune complexes. So we can do an immunofluorescent stain, and immunoglobulin, complement, fibrinogen, all these may be detected out here. So this necrosis is seen where? In malignant phase of hypertension, in the arterioles of the kidney, that you will be seeing this. Apart from that, it can be seen in polyarteritis nodosa, hypersensitivity reactions, so on and so forth. So we have covered all the types of necrosis. Next one, we will go to apoptosis. We will tackle this particular topic in the following order: definition, mechanism of apoptosis, the differences between necrosis and apoptosis, very important from the point of view of examination, role of apoptosis, and the morphology which is there. Apoptosis, programmed cell death. Like the computers are programmed, the softwares are programmed. We have got program in our genetic code. My hair are graying when I'm getting old. That is all programmed. They're bound to gray because of the triplet ATGC. We have got a code. That is why the program is there in the cell. So certain cells are programmed to die. They're destined to die. So how do they die? Through apoptosis, a pathway of cell death induced by tightly regulated intracellular program in which enzymes which degrade the cells are activated in the cells that are destined to die. What is destined to die? Basically, if you see the development of an embryo, okay, this embryo is developing, these two limbs are developing. Here the two limbs are fused together. The tissue in between them has got to die. It is destined to die so that the two limbs are separated. So how does this tissue die? This tissue dies by virtue of apoptosis. That's what we say, destined to die. In Greek, apoptosis means falling off. It just means that falling off. Falling off means what? No evidence is left in the tissue and the organ. No evidence is left that apoptosis has taken place there. Another example, this is the foot of a mouse where the digits have not separated as yet. The tissue will die out here, undergo apoptosis, and the toes will be separated. Okay, what is the mechanism? Mechanism of apoptosis? Cell shrinkage and rounding. What we know is that in the case of the necrosis, cell was swelling because water was entering inside. Here opposite is occurring, cell is shrinking. Why? Breakdown of the proteinaceous cytoskeleton by enzymes caseous. The stimulation of caseous is a central event which stimulates the apoptotic process. What is a cytoskeleton? It maintains the shape of the cell. Like the shape of the body is maintained by the bones, the skeleton we have. The skeleton of cell consists of microtubules, microfilaments, intermediate filaments. All this is a microskeleton. This skeleton is broken down by caseous, so cell shrinks. The cytoplasm appears more dense and the organelles appear tightly packed, obviously, isn't it? Then we go on to the next stage where blebs are formed on the surface of the cell. These blebs extend to form pseudopodia-like processes, and the organelles which are present in the cell, the mitochondria, endoplasmic reticulum, RER, they all migrate into this pseudopodia-like extension, and this pseudopodia ultimately pinch off at the base and form a apoptotic vesicle. Apoptotic vesicle is formed, and this apoptotic vesicle is then eaten away by the scavengers of the body, the pigs of the body, the macrophages. The cell contents do not burst out. That is why there is no inflammation whatsoever. Here again we see what is happening is this particular pseudopodia-like process is there, organelles are moving, pinched off, the apoptotic body is formed, which is eaten away by the macrophages. Here again, the pycnosis, karyorrhexis, and pycnosis are more prominent in the case of apoptosis. What is the significance? What is the role? Both in physiological situations and few pathological situations, we find apoptosis, more so in physiological situations. The programmed cell death during embryogenesis, we have seen organogenesis, formation of organs, developmental involution. We will see thyroglossal duct has got to involute, and even in animals, metamorphosis, the formation of butterfly, isn't it? This picture we have already seen. Then here is syndactyly. These two fingers are joined together, two toes are joined together because the tissue out here has not undergone the apoptosis. This is where the thyroglossal cyst may develop, where the thyroglossal duct may persist, thyroid develops sublingually, then descends down, and the path through which it descends down is the thyroglossal duct. This duct has got to involute, it has got to disappear. That is by apoptosis. If it does not disappear, then thyroglossal cyst is going to develop. This is what is the metamorphosis. See this part out here, this is dead out here. This is because of apoptosis. Finally, certain cells are added, certain cells are dead, and the shape changes and metamorphosis occurs to butterfly. Second heading is hormone dependent. Basically, menstruation at the end of the menstrual cycle. Why does the endometrium shed? Because of apoptosis. Breast, after the feeding of the child is over, after the child has grown, after the weaning has occurred, the breast will shrink again because of apoptosis. Uterus will become smaller after menopause. Why? Again after because of apoptosis. If we castrate, what is castration? Cutting off of the testicles. If the testicles are cut off, sometimes it is in therapeutically, as in the case of cancer prostate, the prostate will atrophy. Why will prostate will atrophy? Because it is dependent upon testosterone stimulation. Next important one is elimination of potentially cancerous cells. Errors in DNA can occur during replication when mitosis is on. In the cell cycle, when the DNA is replicating, there are two gateways, there are two doors at which errors in the DNA are checked. If the errors are detected at these particular checkpoints, then repair process is tried. If the repair process cannot take place, then the cells are sent to the apoptotic cycle and the cell dies, so that cancer does not develop. Okay. Death of host cells after they have served their useful purposes. For example, neutrophils, WBCs, the soldiers of the body, they, after the inflammation is over, they got to disappear. Otherwise, they will harm the body itself. Lymphocytes, after the immune response, and certain self-reactive lymphocytes in the autoimmune diseases, they got to die. They die by apoptosis. Apoptosis in pathological conditions, all those were physiological conditions. Injurious stimuli damaging mainly the DNA. Radiation injury, Nagasaki, Hiroshima, isn't it? Their cells were damaged, they have got to be removed by apoptosis, otherwise they will develop into cancer. Some cells escaped apoptosis and did develop into the cancers. Anti-cancer drugs, which are given to kill the cancer cells. The cancer cell die by apoptosis. Certain viral diseases like viral hepatitis, we see apoptosis. Pathological atrophy of glands after the duct is blocked. For example, parotid gland. If there is a parotid calculus, stone in the parotid duct, the duct of the duct which opens opposite the second molar, Hansen's duct, okay, then the parotid will atrophy. Pancreatic duct blocked by the stone, pancreas will atrophy. The cells will die because of apoptosis. What do we see under microscope? Okay, histomorphology. Apoptosis involves single cell or a small group of cells only. As against a necrosis, involved cell appears condensed because it is shrinking, then inflammatory reaction is absent, the cell becomes more eosinophilic also, and there is no inflammatory reaction. No inflammatory cells can be seen. The macrophages will eat them and the cell will just disappear from there. It will just fall off. Here we see in the liver, these are the hepatocytes, called of hepatocytes. Apoptotic bodies are formed. After some time, the macrophage will eat them away and no evidence whatsoever will be left. Differences between necrosis and apoptosis. Normal cell, in the case of necrosis, the cell swells. Here the cell is going to shrink further. Here the blebs are formed, but the blebs are smaller. Here blebs are larger. They become larger, pseudopodia-like extensions will occur. These organelles will move out. The apoptotic bodies will be there. Here the cell will rupture. Here the cell will not rupture. The same picture is out here. Here what we see is apoptotic bodies are eaten away by the macrophages, while here the cell has ruptured and there are neutrophils present. The inflammatory reaction is there because of the rupture of the cell. Okay, putting in the words, definition, end result of the death of the cell tissue, programmed cell death, apoptosis. Necrosis seen only in the pathological condition. This is seen mainly in the physiological conditions. Also some pathological conditions, many cells involved, few cells involved. Cell swells, ultimately ruptures, cell shrinks, collapse of the cytoskeleton. Blebs are not prominent. Blebs are prominent here from pseudopodia. Apoptotic bodies not formed. Apoptotic bodies formed. Eaten away by macrophages. Inflammation absent. Inflammation present. Okay.